Well, hi, Nikki. It's great you could join me this morning. I know you've been working all evening. You're a nurse in our
I
ER
know.
department.
I
How long,
am. Hi,
how
Al.
long have you been working at the ER?
I actually just joined Almonte Emergency Department in April.
Okay, terrific. And where
hmm
were you
hmm
before that?
I've been at CHIO Emerge for 3 years, and then
Wow,
I've been nursing all over for the past 10 years, but I've been in Ottawa now for going on 4 years. Yeah.
super. So,
What
Nikki,
about
there's been a lot of conversation recently about people being concerned about going to the ER as a result of COVID, and from what I understand, that is actually affecting some of the outcomes that you're seeing in terms of some of the patients that present. What would you like people to know about what's happening in the ER?
I want people to know it's the same as normal. If you're having an emergency, come in to see us. We don't want you sitting at home with chest pain for 3 days and then deciding to come in, because we've been hearing every time people come in that when they're coming through triage, that they're actually anxious and they're worried to come in because they didn't want to increase their risk of catching COVID-19. And we want people to know that we are taking extra precautions when they come in. So as soon as they enter the hospital in the emergency department, we have screeners at the front door. They're going to ask them a whole bunch of questions. And if there's anything that's flagged, they're going to bring that to our attention. And then the nurses at triage are going to decide whether or not the patient needs to go into isolation room. And at that point, we don't want people being scared of that word. It just means we're going to separate you from other people, and we're going to continue your triage with you in a different room. That's all. But we're finding that people have been quite anxious to come and visit us in the emergency department, and we don't want that. We want people to know that we are taking extra precautions. We are cleaning all of our stations between everybody. We are having screeners at the front door, and we make sure that we're taking proper precautions. But we don't want people to be nervous to come to see us, because we're there for people in an emergency, and we just want them to know that it is safe, and we are doing above and beyond of what we can do to take care of them and keep them safe when they come in.
You know, if someone is nervous and they don't present for a day or 2 days, that's really not good, is it?
That's right. That's right. Yep. So if someone, for example, is having chest pain and they wait 3 days or 2 days to come in, at that point, they could become increasingly much more ill. And very dangerous for them, as well as people coming in with shortness of breath or even fever for potentially even greater illness that we have to do tests for that determine they need more treatment for. The longer you wait, the more at risk you are. And what we're saying is, when you are at home and you're worried, and that you're worried about your health and you can't get into your family doctor, or you feel like you can't breathe, or you have chest pain, we don't want you waiting, because the longer you wait, the harder it is for your outcome. And then it might have, your delaying treatment can very well delay your outcomes, especially recovery times for things as well. Can take much longer. You could end up being admitted when something we could have taken care of a couple of days before.
So, so what you're
Yeah.
saying is, if you don't feel well, if you're really sick and you're thinking about going to emerge, don't let COVID interfere with that thought process.
That's right. Exactly. Exactly. Yep. Just like before COVID, if you felt like you need to come to the emergency department, you came in. Same thing goes for now. We want you to come in. We're here for you. We will take care of you when you come in. We'll make sure that we're taking extra precautions, and don't sit at home with it. We want you to come in, and we don't want you to be nervous with it. We understand completely where the fear comes from, but we just want to reiterate to everybody that we are taking the proper precautions, and we're not trying to increase anybody's risk for COVID-19 when they come in. We are taking those precautions. So especially over these holidays, we really want to encourage people to come in. Our services are still there.
That's one of the things that's interesting. People often only think of the hospital now in terms of COVID, but we're still delivering babies. We're
That's
still
right.
having the emergency department. We're still doing physiotherapy. We're still
Yep.
all of those things. Nikki, thanks a lot for sharing this information. It's important information and we really want to get it out, and have a good sleep.
Thank you so much. Thank you for having me, and happy holidays. Merry Christmas. Stay
And,
safe.
and to you, Nikki, Merry Christmas. Thank you.
Thank you.